Welcome to the wonderful world of orthodontics. Congratulations, you're on your way to a new, beautiful, healthy smile. Our goal is to provide you with an amazing experience, but that's going to require team effort. Your role throughout treatment is very important and very simple. You just need to follow a few recommendations. And here's Nikki to tell you more.
Thanks, Dr. Spillers. That's right, orthodontics is a team effort. And to get that beautiful smile at the end of treatment, you need to take good care of your braces and yourself when you're away from our office. Okay, so now that your braces are on, let's review your home care kit. In your kit, there are lots of dental hygiene items to help you with your home care. There's a toothbrush, floss, and floss threaders, a proxy brush, wax, a food list, and a prescription for the fluoride toothpaste Dr. Spillers wants you to use nightly during your treatment. Let's begin with brushing. To prevent damage to your teeth during treatment, thorough oral hygiene is imperative. Poor or mediocre care of your teeth can and probably will cause permanent and unsightly damage. Don't let this happen to you. Follow these steps to get into a good daily routine of brushing and flossing. You will move your toothbrush in a circular motion and turn it in 3 different positions: the top of the braces, the bottom of the braces, and the front of the braces, spending at least 30 seconds in each position. Let's start with the top of the braces. Start by brushing down on top of the braces, placing enough pressure on the brush to get the tips of the bristles under the wire. Brush from one side to the other several times before you move on to the next angle. Next, brush up underneath the braces, again placing enough pressure on the brush to get the tips of the bristles underneath the wire, brushing from one side to the other several times before you move on to the next angle. And lastly, brush directly on top of the braces and wire, repeating this motion several times. Remember to gently brush the gum line too. That's where your teeth and gums meet, and doing that will keep your gums from getting swollen during treatment. Also, don't forget to brush your chewing surface and the back of your teeth. You will need to brush for at least 2 to 3 minutes each time in order to ensure that every surface is clean. We ask that you brush your teeth at least 3 times a day or after every meal. Now let's review how to floss. When you have braces, you will need to thread your floss under the arch wire. To help you do that, you will use a floss threader. Start with approximately 18 inches of floss. Pull 4 to 5 inches of the floss through the loop at the end of the floss threader. Now thread the floss threader under the arch wire and gently go in between the teeth, hugging the sides of each tooth. Remove the floss and continue around in between every tooth. Next is your proxy brush. Sometimes it's hard to get in all of those nooks and crannies when you have braces. This little brush is designed to help you clean those areas. To use it, simply push the brush gently under the arch wire between the brackets. Now, if it's difficult to push the brush into an area, don't try to force it because you might accidentally break a bracket. So only use the proxy brush in those areas where you can be sure and use it gently. Remember, we recommend that you visit your dentist every 6 months while in braces. This will ensure that you haven't missed any spots while in orthodontic treatment. Okay, now let's talk about wax. As you're getting used to your braces, you may experience some sore spots on the inside of your cheeks and lips. If this happens, you can use orthodontic wax to cover the area that is bothering you. Simply pinch off a small piece of wax and soften it between your fingers and place over the area that is bothering you. You will want to remove any wax before eating and brushing. However, if you should accidentally swallow any wax, it's not harmful to you. Did you know there are certain foods you should avoid when wearing braces? Let's review this list. You will still be able to enjoy most foods with some exceptions. We ask you to avoid hard, crunchy foods which can damage or break your braces. Avoid hard nuts, pretzels, Jolly Ranchers, meat on bones, and chewing ice or any foods like these. Be sure to cut up your hard fruits and veggies into bite-sized pieces and place them in your mouth instead of biting into them. We also want you to avoid sticky, chewy foods like caramels, taffy, Skittles, Starburst, gummy bears, and of course gum or any foods like these. These types of foods can and will damage your braces, which may possibly add time to your treatment, meaning you could end up having your braces on longer than estimated. Now the good news is there are lots of great treats that are okay to eat during your orthodontic treatment. Softer foods like plain chocolate bars, Reese's Cups, Hershey's Kisses, cakes, pies, and soft cookies, as well as any other food like these. As a normal part of your orthodontic treatment, you may experience a dull, achy sensation for 2 to 5 days after getting your braces, and possibly after each adjustment appointment. You can take Motrin, Tylenol, or whatever you normally take for a headache or muscle aches to relieve this discomfort. For any soreness from your braces rubbing on your cheeks, remember to use your wax, but you can also use warm salt water rinses, just 2 tablespoons of salt dissolved in 1 cup of warm water. You can also use Orajel to rub on the sore area to give you some temporary relief while you're getting used to your braces. In no time, you will adjust to your new braces and soon feel good as new. Accidents happen. If you should break a bracket, band, or wire, save any parts and call our office to see if you need a repair visit before your next scheduled appointment. Keep in mind that if a colored elastic comes off, they are only there for decoration and do not need to be replaced. We will schedule an appointment to repair your braces so you can stay on track. So that's it. Pretty simple, right? Just be careful and we know you'll do great. That's pretty easy, don't you think? But after a while, if you forget some of those things, don't worry. You can see this video again anytime. Just ask us how. Right, Dr. Spillers?
That's right, Nikki. And remember, your assistant can answer any questions you may have before you leave today. And you can always reach us by phone anytime if you have any questions, problems, or concerns during your treatment. Congratulations! Let's work together to make sure you get that beautiful smile you've always wanted and you deserve.